Hi, I'm so humbled to be here today to share Central Pennsylvania. First patients we had in our care transitions program was Betty, and her journey over the last 7 years really describes how we've transformed care in Central Pennsylvania. Betty was 67 years old. She was recently widowed, and she was living in a senior community in York, Pennsylvania. And while she lived there, she really didn't interact much with her neighbors. And this is really surprising, because Betty, in her day, was a force to be reckoned with. She was a community activist involved in many social causes. She was a founding member of the Community Progress Council. Betty took on racism and women's rights in the 1970s in our community, which was a pretty tumultuous time. Thank you. Which was a pretty tumultuous time. In addition to that, Betty's family, as with many of us, grew and expanded and moved around. Betty's life had become pretty isolating by that point. As we started our work, we knew that Betty had diabetes and we knew that she had osteoarthritis. What we didn't understand was how Betty's loss of life purpose was really impacting her health. You see, Betty had unresolved grief. In addition to that, she had a growing alcohol dependency that she was hiding from many people, and that led to more social isolation. Betty's diabetes was poorly controlled. She sporadically would visit physicians, and when she went to the doctors, she would come in and get treated for the issue in the heat of the moment. Her care team really didn't know Betty well. They didn't know her goals, her aspirations, or even what everyday life was like. But that all changed as we began transforming our care. Today, when Betty doesn't come into the doctors, she gets a call from her office reminding her of the importance of a follow-up visit and follow-up blood work. The care team, when she does come in for a visit, is prepared for that visit. We have tools in place to identify care gaps and protocols to address those issues. Today, Betty has a care coordination team, a health coach, a case manager, and a social worker who work with her and get to know her and work with her primary care physician and the rest of the care team to coordinate her care over time. And this really became important because Betty, about a year ago, fell and fractured her hip. And as a part of that, she had recently had a previous hospitalization, and she had been working with a care coordination team for about 6 months. And so they knew that something just wasn't right. They couldn't quite put their finger on it, but they understood enough that something wasn't right. And so at that time, they mentioned to Betty that we have a new program that we partnered with in our community called the Care Transitions Program. And they asked Betty if she would participate in that program. It's run by our local agency on aging. And Betty agreed. And so the transition team met with Betty in the hospital, and then they met with her again in the nursing home, and then again in her home. Through those interactions and the work with her care team and the transitions staff, we identified some opportunities for Betty. She could start to attend the health education classes that student nurses were performing in her building, and Betty started to attend. She could learn some new things. Betty's niece had given her a laptop, and she didn't know how to use it, and she was somewhat afraid to ask. She was intimidated by it. And our local agency on aging has classes for seniors to support them in learning how to use the computer. And today, Betty uses her laptop to communicate and connect with family and friends. Betty could also get more involved in the community. So they talked with Betty about the fact that she could volunteer at the local agency on aging. And today, Betty volunteers once a week at our local agency. Someone was asking me, Ann, out of all the work you've done in the last 7 years, what made you want to share Betty's story? Well, it's simple. Who among us doesn't know a Betty? Doesn't know someone who's kind of lost their life purpose and their health has suffered as a result of that? What a gift it is to be able to give someone new purpose and hope. And to know that that came about from the work we've done the last 7 years, well, that's just precious. But more important than that, our work through Aligning Forces and what we've come to recognize in our community is that if you really want to make a difference in health, it takes more than healthcare. It actually takes the community. Thank you.